We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
It was right before Christmas in 2020. FilAm Angelo Quinto, a 30-year-old Filipino-American veteran and California resident, needed support during a mental health crisis. His family called 911. When police arrived, they handcuffed him and kneeled on his neck for over 5 minutes until he stopped breathing. They brought him to the hospital, and within 3 days, Angelo tragically passed away. For this episode of Makilala TV, we will hear from Angelo's family and mental health experts and organizers on the importance of addressing mental health, especially during a pandemic. I am joined here with my co-hosts, Jen Ferrer and Cristina Pastor, and also with two guest speakers, Maria Rubio and May Madarang. Maria, who is a registered nurse and educator who specializes in psychiatry and mental health. She has specific training to work in psychiatric emergency rooms and is an expert in preventing and managing crisis situations. We also welcome guest speaker May Madarang, who is a violinist, cultural worker, and community organizer. Her passion lies in combining art, activism, and faith-based organizing to mobilize communities for change. She's the Northeast Regional Co-Coordinator for NAFCON, the National Alliance for Filipino Concerns. She's eager to offer her support and commitment and has a deep love for our kababayan, both here and back home. So let's start with May. Tell us a little more about NAFCON and your role in getting justice for FilAm Angelo.
Hi, hello everyone. My name is May Madarang, and yes, I'm part of the National Alliance for Filipino Concerns, NAFCON. And yes, when we heard about Angelo Quinto, actually for us here at NAFCON Northeast, it actually did take us a while to hear about the case since it happened on the West Coast. But coming into January 1st, especially with the new administration, we were talking to a lot of our community members about it. And when we heard about it, we wanted to ensure that we were getting information from our community members. And so we started, asking around about what their issues have been. And so we've really been working both with NAFCON on the West Coast as well as NAFCON Northeast to really bridge that understanding with our community through education.
Great. And, Maria, I feel like that, welcome back to Makilala first. I know that we've had you at an earlier episode specifically on FilAm's and Black Lives Matter. So I'm so thankful that you're able to join us again. So hearing from, the works of NAFCON, how do you think your role as, a mental health professional come into play in cases like that? If the family calls 911 and says it's a mental health episode, shouldn't the police come with someone like you?
Yeah, absolutely. I mean, thank you for having me again, guys. So as a registered nurse, I specialize in psychiatry and mental health. Specifically, I work in psychiatric emergency rooms. So you'll see a lot of emotionally distressed persons come into our facility. And Angelo Quinto would have been one of them, right? So he was having a situation, an acute situation. And unfortunately, in many of these situations, the police are called and they're not specifically trained in mental health. So as a mental health worker, a lot of us do agree that we should be on the front lines of this particular situation. It would have definitely helped if he had an advocate who knew his needs and how best to address them.
So if someone was having an episode or need to be stabled, who are we supposed to call? Do we call 911? Do we call doctors? What is the protocol?
Right. So we always say that when there is an emergency, a mental health emergency, the default is to call 911. And depending on where you are located, there are some cities that do have in place mental health task forces that will allow mental health workers to be there. And some cities that unfortunately, like New York, that do not have that so far in place. I have heard that Mayor de Blasio is trying to set something up similar to that. So in a mental health emergency, you would call 911 and you would be brought to a psychiatric emergency room, a place where I work. And we are specially trained to try to help people that are in very serious, emotionally distressing situations.
So May and Maria, I'd like to ask you both, why isn't the Angelo Quinto case not getting the same kind of attention as the George Floyd case?
I mean, to be honest with you, in the last 10 years, if you were to Google the people that have passed at the hands of police officers, the list unfortunately numbers a lot of people. And who's to say why some kind of stick in our memories and some don't? You know, of the dozens and dozens of names, there are only a handful that have recognition, if that, you know, is because they occurred during a time when people were specifically ready to galvanize, you know, or if it's just a specific part of that incident that kind of caught on. No one is really to say, but it, you know, it just kind of happens, I think. I don't think there's anything in particular about Angelo Quinto's case that makes it so that he was more or less favorable to be held in the spotlight. It just kind of happened that way.
May, your thoughts?
Yeah, I also agree that you know, what has been happening, a culmination of these issues have kind of really been happening for quite a long time. I think that maybe where we are at this current moment, understanding that you know, where we're at, just being able to understand that these issues that are happening around all different communities have been impacted, and that I think one of the things that NAFCON has been trying to share with folks is that you know, one person's hardship is no different from another person's hardship. We recognize that, you know, death is death, and that has impacted everyone in this issue.
So what is now the status of Quinto's case?
Yeah,
From a
I
legal
can.
standpoint.
Yeah, I can talk about it because basically NAFCON has joined the coalition for justice for Angelo Quinto and all those who have experienced police brutality. There has been a coalition that has been talking directly with City Council in Antioch, California, and there has been plenty of community meetings and demands that has been brought to the city of Antioch. Specifically wanted to share some of the talking points that have happened in these meetings, basically talking about asking, you know, addressing the root causes of police accountability for the, you know, violations of public trust, right? Urging that we commit ourselves to figuring out what public safety is like through community accountability. And so there have been like 5 particular demands that they have asked for. It being investing in mental health response teams, like what Maria had mentioned, holding officers who participated in the murder of Angelo Quinto accountable, redirecting funds from the police department and investing them in community-led solutions that reduce harm, as well as creating transparency for the officers by using body and dash cameras, as well as releasing data that when force is used, especially racial and gender profile who are subjected to police force. And finally, the last point is that, especially similar to George Floyd, is the ending the use of the knee to neck restraint technique,
Yeah.
and publicly sharing protocols around force and restraints. So.
Yeah, this was also in a petition, an online petition that's happening right now. So thank you for sharing, May. We can also share that petition on Makilala and see if anyone is interested in signing on and supporting that. I think that this is a good time to actually hear from the family themselves and hear, from their point of view, what happened, because they were there when their son was tragically taken from them. So let's hear directly from Angelo's family.
Thank you for inviting us to speak and share more about this. I was first just going to say a little bit about Kuya, just that he was a very multi-dimensional person, just like anyone else, and he was as imperfect as anyone else. In all his life, he struggled, especially with undiagnosed depression, and that led to misfortune. It led to making mistakes. It led him to find new enthusiasm for life and gratitude and determination to move forward. When I saw him purple and they were administering CPR, I just didn't believe that this could happen, because he was just such a determined person. And sorry, just as a human being, he deserved so much more than what he got, and so much more than, I'll let my mom speak a little bit.
My name is Cassandra, Angelo's mother. Angelo should not have died. There was no violence, no struggle with the police. He was compliant. He did not resist. I never left. I was watching. I trusted the officers and thought they knew what they were doing. How I wish it was a bad dream and I'd wake up and see Angelo again. I was not able to protect him. I will never forget it. And I imagine the officers involved won't either. My biggest regret is that I should have aimed the camera at them, showing one officer kneeling on the back of Angelo's neck while handcuffed, and the other officer holding his crossed leg up against his butt. That would have prevented them from keeping Angelo in that position. Angelo should be alive today, but instead, here we are, telling his story and seeking justice and trying to make sure that no more families will go through what we are going through right now. At least I was able to hug him in his last moments, which is what he wanted, to feel safe and comforted by Mom. We need transparency and accountability. Thank you.
So thank you for having us here. We think that Angelo's life was lost in vain unless we can bring about some really needed changes. And there are so many potential changes that we would like to see, but we have to narrow it down. And so we have been at the local level trying to, number one, make sure that the Antioch police, the California police, and really that our nation's police forces and the knee to neck restraint procedure that they used on Angelo. We don't see why that is something that should ever be a technique that they can use. It's been misused many times, even just in Antioch itself. So we think that's something that should be ended. We were calling for also for mental health crisis response teams and for body cams. Antioch didn't have that, which most police departments do have. We thought they had them originally. The good news on the mental health crisis response teams and body cams for Antioch is that the city council has been moving forward. We've been working with many of you in the Justice for Angelo Quinto and Justice for All Coalition and our family and other members of the community and activists in the community to try to bring about police reform. We were fortunate that Antioch had voted in a reform-minded city council. 3 out of 5 council members are trying to bring about reform. So we are working with them to try to bring some of those reforms. Going forward, we're also trying to see what we could do at the state level to see if we can ban the knee to neck constraint at the state level, because we haven't gotten traction on that in Antioch. And then seeing whether we can have a Bill of Rights or other rights for families that are similarly affected as us, because we don't want this to happen to other people. As Cassandra said, Angelo had a really hard night that night, and he was really paranoid, but he didn't do anything to deserve what happened to him. The shocking thing is that he wasn't being violent. He was completely calm by the time the police arrived. And he was put on a restraint because it was easy for the police, I think. And we really want to make sure that that doesn't happen to other families and they don't lose a loved one the way that our family lost Angelo. So thank you.
Yes, and I guess what we just ask of anybody in the community is that you just keep sharing his story and talking about what it means to you, and I guess also keeping an eye out for what we post on our social media accounts. We've done a lot of work, or we've had peaceful actions at city council meetings, and we are going to continue with that. Thank you.
Thank you.
Yes, thank you to the Quinto family. I mean, just hearing from them directly, you can really tell how much this has affected not just their lives, but their community lives. The father was talking about police reform, and that means so much differently to different people. May, can you and also Maria, can you tell me, what does the term or the phrase defund the police mean? Because I know for me that's a very triggering phrase. What actually does that mean?
Yeah, thank you for sharing with that. I think that is important to talk about what we mean by removing. There is a lot of money spent on policing, police forces, and really what we understand for defunding police is really asking for the resources, the allocation of our tax dollars to be redirected to programs of being able to access mental health needs, being able to have, things like mental health response teams conducted, proper training, also programs within our communities that can benefit from preventative measures of, the cases like this.
And
Maria, have you seen an uptick in mental health episodes during the pandemic in our community?
Absolutely. So what happened during the COVID crisis was a lot of the psychiatric facilities in hospitals were closed down, or their staff were reallocated towards COVID patients, right? So what ended up happening was many people that would seek help for psychiatric issues were left without resources or with very limited resources. And so that when they did become available again, there is an onslaught of, people who need help. And so that, in addition to the fact that there have been less resources in general because of the pandemic, right? A lot of people have lost their jobs. People are isolating, and so they are feeling more anxious. They are feeling more depressed, right? And so this has heightened a lot of emotional discourse within our community, and a lot of people are just feeling upset in many ways. And so it's definitely been there's definitely been an uptick of higher acuity cases and more cases coming into the emergency room, psychiatric emergency room.
Well, Filipino Americans, I don't think mental health comes with, they think about therapy. Usually they go to a priest first, or it's like you can go through, you should do it on your own. I mean, how can we change that? And then what are the signs they have to be aware of, and where do you get help? I mean, I know during the pandemic, it was hard to find, especially when you need someone right away, it's hard to get assistance.
Absolutely. Those are really great topics to touch on. So in the last few years, thankfully, mental health has entered the popular lexicon, right? Like we talk about self-care, we talk about what it is to be mentally aware and aware of our own needs. And so a lot of people, especially in my generation, so Gen X, Gen Y, Gen Z, millennials, however you want to call them, are more in touch with the need for mental health, right? And so I have seen in my own practice, although people of my parents' generation may not be as similarly inclined to seek professional help, people of my generation definitely more inclined to do so. And so it has also been people of my generation who will reach out to our parents and say, so listen, I know there might be a stigma about this, but there are also really great things that can come about finding the right therapist, finding the right people to turn to. And, it doesn't necessarily have to be limited to therapy. Therapy in the terms of like a therapist, a psychiatrist, it could also be a priest. It could also be a trusted person within the family. There are so many ways to seek guidance, specifically for very serious things that you might be going through, like depression, suicidal ideations. So things that you would look for example, are changes in sleeping, changes in appetite. You may be just very sad and isolating yourself, right? And more so if a person is talking about wanting to hurt themselves. So
do you call your doctor, or who do you do? I mean, who do you call
right.
when you say my child just told me he wants to kill himself?
Absolutely.
So what do I do?
So suicide is a very serious issue to deal with. And so we would say call the hospital, right? Call if they have a therapist, if they have a doctor, a psychiatrist, you would call them. And more likely than not, they would call 911 and you would be brought to a psychiatric emergency room. And from there, they would be assessed and evaluated by psychiatrists and mental health professionals. And we would see what kind of care they need. And that would be the step to take.
Yeah, I mean,
May, going back to the Angelo Quinto case, what has happened to the officers? Have they been removed from the service? Have they been identified even?
Yes, they have been identified, and basically through the coalition, we have been talking with the police department of Antoc about what accountability for these police officers are. And so through the city council meetings, they have been having more direct conversations about what police accountability will be for this case. And I think the father did mention a few of those as well in his interview. But if I can also piggyback from what Maria was sharing about, or I'm sorry, what Jen had asked was, in terms of what NAFCON can provide, actually that I'm glad that our community come to us first, right? You can call the 1-800, we write it on our webinars, if, right before the webinars start, or the, online events that we've been having since last year, we've actually been putting in the waiting time the New York wellness hotline if people really need it. But what we've also experienced is that sometimes the hotline won't be necessarily culturally competent about our needs as like people, like our collective like sense of self, and not, and feeling like if I have mental health issues, then I'm selfish for having needs for myself. And so those don't always necessarily work out in a crisis situation. So we are really glad that we can offer and be like the first line of asking for resources so that we can either help someone in an emergency, or also practice what a safety plan looks like. We use this for people who are undocumented. Also, what is it creating a safety plan for people who don't have documentation and want to be able to feel freely move from place to place. We also have safety plans for people who have a heightened sense of mental health needs and people around them who may not know what those are, what that would look like in a case scenario. So practicing those situations are really important.
Yeah, I feel like that this conversation can go to 10 more episodes on mental health and addressing it in the FilAm community. Unfortunately, we don't have any more time, and we do have to begin closing the episode. So I do want to ask May and Maria, what is, well, one is how can we reach out to the NAFCON coalition, and also what is your final message that you'd like to share with the community? Maria, you could go first.
Oh, sure. So specifically, I just want everyone to know that mental health is an important issue and that there are resources available, right? And as a mental health professional, I want everyone to know that we are culturally competent, that many of us in the community work within our communities and want to reach out and provide as much help as possible. Nobody's doing this by themselves.
Yeah, definitely. Yeah, I think that what's important is that NAFCON has been promoting this Filipino American agenda, which has been uniting Filipino Americans around, the many concerns we've had during the pandemic. And it's through like all these town halls we've had, like 14 states, 100 endorsers, 1,000 people engaged. We have been able to compile a list of needs around, workers' rights, immigrants' rights, youth and students, women, LGBTQ community, small businesses and property owners, education, foreign policy. And because of all these town halls, we actually were able to add the 9th point around police brutality, anti-Asian violence through the dialogue we've been having with Angelo Quinto and the coalition we've been building. So, we have actually, in the 100 days of Biden's and Harris administration, we've actually been compiling this particular Filipino American agenda to present to, because there's actually a Filipino, Jason Tenko, also the Asian American Pacific Islanders Caucus, and various agencies and elected officials, that we hope that this Filipino American agenda addresses a lot of the concerns, especially mental health, but all the different things that are happening to our community, as a means for us to just like level off that this is what we want for ourselves. And if you haven't read it, I encourage you all to take a look at it and maybe give us feedback, because it's through our personal discussions with each other, grassroots communication, even alongside with legislation and politics, political advocacy, we're able to really be able to continue to build unity for our community and see change. So I actually want to invite you all. We actually have a community dialogue happening next Friday for NAFCON and Kabataan Alliance, which is also the youth alliance that partners with NAFCON. So please.
I know that you have a lot of upcoming events and resources, so we'll definitely refer people to the NAFCON website. And for those who do want to know about the phone number that was mentioned earlier, it is 1-888-NYC WELL. That's 1-888-692-9355. We do have to begin closing. I do want to say thank you again, May and Maria, and also the MNN team. Maraming salamat to all our supporters and viewers. This is Makilala TV. Thank you.